Welcome. This is Wellness and Growth Journeys podcast, and I am your host, Mia Lisa Garnes. And today, joining us in our virtual studio is Dr. Vicki Estwick. She's a dedicated general practitioner and an award-winning intern known for her commitment to patient education and healthcare literacy. Beyond her medical expertise, Dr. Esther is a passionate fitness advocate ready to share her insights on the role of exercise in managing chronic illness and aging. Welcome, Dr. Victor.
Thank you very much.
So tell us a little bit about yourself, where you are right now. What's going on? Tell us before we get into the line of questioning that we have here. Not too many, but let us know.
As you would have mentioned, I am a general practitioner who is focused on exercise in chronic disease and healthy aging. I have been a doctor for 11 years. Throughout my practice, I've practiced in Antigua and here. And throughout the practice, I've realized that we recommend exercise for everything, but then that's it. We don't know what to recommend past that. And I find a lot of patients actually want to start exercising, but they're afraid to start because, well, I have this heart condition, or I have high blood pressure, or I have diabetes, and I don't want to hurt my feet walking, and so it's difficult for them to figure out where to start. I also realize there are some patients who may have gone to a gym, and because the basic certification offers so little insight on how to work with persons with chronic disease, a lot of people, even though they're qualified personal trainers, may not know the nuances, such as what medications they're on and how the medications affect their heart rate, or
That's true.
what kind of symptoms somebody might have, because they're not medical professionals, or they, at least they're not trained as medical professionals in your basic certification. So I realized that gap in the knowledge, both from the medical professional side, from the fitness professional side, from the patient side. Everybody's like, yes, exercise is great.
Right.
Okay.
And
And silence. We
and
don't know
silence.
what to do
Just do
outside
it.
of
Just yeah.
walking, running, and lifting
Going to the
heavy
gym.
weights.
Yeah,
Going to
going
the
to the
gym.
gym.
So, and then when I get in the gym, all right, I've signed up for the gym.
What do I do?
What do I do? So,
I remember or I know that cardio is involved, and I know that like lifting weights, and I can watch this person do it, and then I can go and do a few, and then whoop, I did it.
I did it, and after 5 minutes, you went watching the advanced person, and you're like, oh no, exercise is not for me. I'm canceling my membership. I'm just gonna sit down at home.
True. Yes, or you just go one day. Yeah, you're like, yep, I can go back tomorrow, and then tomorrow
It
you
doesn't
don't
happen.
go back
Yeah,
anywhere. That's true. So
exactly.
what
So
is that? So is that the catalyst for what really inspired you to focus on chronic illness?
yes, there was one particular patient I had. I tell this story all the time, so I apologize if you've heard this story before.
I have not. So tell me.
But I had a couple, and both of them had high blood pressure and diabetes, but the husband had heart failure, the wife did not. The wife wasn't so much into exercise, but when she did, she could do so pretty easily. But then the husband really wanted to exercise more. He said, he can't seem to stay consistent, and I asked why. And he said, that when he tries to do it for at least half hour, and he tries to get, 45 minutes, and he goes, but he gets so tired and he gets frustrated. And so there are two lessons here.
Right.
One, I had to tell him, stop trying to keep up with your wife.
Oh, that's what was happening.
That ego thing, stop trying to keep up with your wife. Why? Because you have heart failure and she does not. Cardio works your heart. Your heart literally cannot work as hard as hers.
Right.
So I had to actually tell him, like, you need to actually cut back on how much exercise you're doing. Limit it to half hour max. He was trying to do at least half hour. No, I don't want you to go over half hour. His heart rate was going up to the 160s. I was like, no, your heart rate actually, when I calculated it, should I have gone above 100? So like you're doing too much. And after they left, I really thought about it. And this is after I had started on my own fitness journey as well, because I wasn't always active. I wasn't an athlete. I played no sports in school. So don't look at me like a sports person. I suck at sports.
I was so bad at it. I mean, I tried it, right? But I was so bad at it.
Yes. And people think that you need to be into sports to be active. That's not true. You don't need to be into sports to be an active person. But yeah, thinking about it, I'm thinking, what if he saw another doctor that wasn't into fitness, that didn't ask those questions, that didn't go and calculate his heart rate? Where would he be? He actually came back a few months later and he said, "Yes, you know what? I'm sticking to it. It's a lot better now. I still feel challenged, but I'm not getting like tired and cutting out." So by actually cutting back how much exercise he was doing, he was able to stay more consistent.
And that's all you need. I think that's a struggle for most people. So, like, if you say, yeah, you could do a lot less and that actually is better for you, yeah, I think you'll be more inclined to be consistent with that.
So yes, all of that happened, and I found myself accepted into a program in London. And this was on the tail end of COVID. And everybody's like, "Vicky, you're leaving your job. That's crazy. It's COVID." I'm like, "Yeah, I'm gonna go and do this degree now." Okay, bye. And yeah,
Because listen, well, I'm going to get you to explain to me what chronic illnesses entail. Like, what is really chronic? What is chronic illness? Um, because then I'm thinking it'll be, would it COVID? Would it, like, I guess illnesses or major illnesses come out of COVID?
right. So a chronic illness is an illness that basically lasts more than 6 months. And for many of them, they're incurable or they might be curable, but it goes through a process. So things we hear about all the time, we hear about NCDs, we hear that acronym all the time, non-communicable diseases, and all that means is that it's not an infection. So we have things that we hear about, like hypertension, diabetes, asthma, obesity, but there are also things like sickle cell, the autoimmune diseases such as lupus, myasthenia gravis, kidney disease, cancer. All of those things fall under chronic diseases. And the sad thing is that a lot of focus stops at the hypertension, diabetes, obesity.
I was just gonna say at those because you hear a lot about that, right? You hear a lot about those types.
Yeah, like, those are the major drivers for a lot of mortality in our society. So you will hear more about those, but exercise is actually beneficial for most, if not all, chronic diseases. So that includes the ones that you don't hear about as much.
But that's cool that you decided that you just want to specialize in that. Um, that is actually quite interesting because when you when you have these kind of illnesses, the first thing you think about is, well, I gotta be doctor and I gotta be put on medication, and I probably give me a medication for the rest of my life, right? But so I guess let me know, how does exercise then, I guess, maybe assist or even help change your trajectory when it comes to these chronic illnesses.
Right, so exercise affects chronic illnesses in different ways, obviously, because the chronic illnesses have their own method of wreaking havoc on the body. But at a baseline, uh, moving the body, moving the body improves most of the body's functions, literally from head to toe. And for example, for high blood pressure, it actually lowers your blood pressure overall by about 8 to 9 millimeters of mercury. So you will hear about the normal blood pressure being 120 over 80. Someone with hypertension might be 140 over 90. And that reduction brings them back into a safer range of the 130s over 80s uh, just by consistent exercise. That combined with, or I don't like the D word, diet, we're not going to use that D word, a change in eating practices because it's not
Okay.
short term and it's not restrictive in the way that we
Right.
think it is.
Okay.
We're changing our eating practices. And that and exercise, that those two alone lower your blood pressure so much. Now,
Oh,
what I
that's good.
always tell people is
Hmm.
that the medication then helps your body to do what it's supposed to be doing that it isn't doing.
Okay.
So
Okay.
people think that medication is a replacement for changing your eating habits and exercise. It is not a
Right.
replacement. It is
No.
used along with,
Right.
right?
Right.
So we start
But
with
most
changing eating
effective,
habits
yes, when you do it like
when you
that.
do all
Even
together, right?
right.
So
Right.
so yeah, so exercise tends to be that one that is left out a lot, uh, because people are tired, people don't have time, they're always at work, they have the children, they have the parents, all kind of stuff. But
It's
I definitely
true.
work with people to try to find out a way that
Find
they can actually
time.
fit exercise in.
Yeah. I think too, like we're so accustomed to, I guess, our routines. So now to kind of, I guess, change it up. A lot of people are resistant to change. We say we want to, but when it comes down to actually doing it, actually making the change happen seems to be like the biggest hurdle that a lot of people face. Um, just getting it so you're so accustomed to your routine and it works for you. So you're like, now how do I now implement an exercise routine? How now do I make some changes to my nutrition and what the way how I eat? Especially if you're like a woman and you cook for the entire household and you know they don't want to go on your they don't want to go on your meal, your sorry, the D word. They don't want to go on that. So then you're thinking about, oh, that means I ain't got to cook two different meals and like how to. So I think all of that might, and we probably building up in our head as well, but all that might be um, what make people a little bit hesitant about incorporating these changes into their lifestyle because it's pretty much like how am I gonna get that done, right? So what are some key exercise strategies that you would recommend for individuals with some of these chronic conditions that you mentioned, and how do these adapt as they age? So, you mentioned you didn't say how old the couple was, right? But like as you get older, then in some of the conversations I've had with health coaches and everything, they say like as women get older, you gotta lay off the cardio and go more with weights and that kind of thing. So how exactly do and what do you recommend? What's a good way to start?
Start where you are. That's the first thing I'm going to say. Start where you are. People, well, the doctor will tell you, and I'm sure most people have heard this from their doctor. You need 75 to 150 minutes of moderate to vigorous exercise per week.
I don't know which doctor you mean because I haven't heard that exact.
Or they will tell you you need 30 minutes of exercise 5 days a week.
Yes, I've heard that. I hear a minimum of 30 minutes a day for at least five. I think they said you could start off at like 3 days and then kind of work your way up to 5 days.
Kind of sounds
Yeah.
like a recitation, right?
It
Because
does.
that's what we're taught about exercise, full stop, end of story.
Yes, that's true. That is true. And go walking. I've heard like, don't, you gotta do the gym. Just like go for a walk,
And
half
if
an
your
hour.
knees hurt, go to the beach.
The beach is always the answer for anybody in Barbados.
And
To the
then
beach.
poor 76-year-old Gertrude that live in St. Thomas, that she son gotta go work, so he can't drop she to the beach. And then on Sunday she gotta cook for the grandchildren. and you're telling this lady you need to go to the beach, and she's looking at you like,
Yeah. Yeah.
how
When?
you can get there? When? How you
How?
can get there?
When?
Exactly. So this is where we talk about start where you are and start with what you have. There's
Yes.
no one size fits all for exercise. There's no one way that exercise looks. What we'll
Yes.
start with is that exercise is a dedicated, so
I hear
not
it.
your
Yes.
everyday things.
Mm-hmm.
It
Mm-hmm.
is a dedicated time with the intent. So we talk
Uh-huh.
about intentional, with the
Yes.
intent of improving one or more areas of your fitness. So this is
Hmm.
where you set aside time.
Yes.
So working in construction is not exercise, that's physical activity.
Let's say I got another one for you. Picking up the
Going up the stairs
children.
at work,
Yeah, yes.
yeah, going up the stairs at work is not
Yes.
exercise, that's physical activity. You need both. You
Right.
need both physical activity and exercise. So your physical activity is the amount of movement that you do throughout your day. So that's how far away you park from the supermarket, taking the stairs instead of the elevator, that
Yes.
kind of stuff that you hear about.
Yes.
The exercise now is you can start with as little as 10 minutes, as
Right.
little as 10 minutes,
That sounds
and
amazing. 10 minutes sounds great. Everybody could
intentionally
do 10 minutes.
10 minutes.
Yeah.
Start with 10 minutes. And something as simple as we still say going for a walk. So if during your lunch hour, you have an hour for lunch, if you take 10 minutes to go outside, or if outside too hot, up and down the corridor for 10 minutes, that's exercise.
We trying to sweat. So let me, so like because if you're going for the walk but you're sweating, is that considered exercise still?
Sweat is not a measure of how vigorous your exercise is, actually. It is based on your heart rate and your breathing rate. So you might have someone who doesn't sweat much, but when they're walking, they can't speak in full sentences. This is when you're talking like that, that's moderate exercise. So the people that you see walking, having a whole gossip session, they need to walk faster. They need to walk faster.
Ooh, let me not go there. Because I see a few on the highway. That's the truth. I see a few on the
It's great
highway.
that they're walking. If you're walking and having a full conversation, you need to be walking faster.
And it's a full conversation when you see the hands going. When all of this happening, it's a full conversation going on. So you hear that, ladies? I mean, it's good to have the company, and that kind of thing. But yeah, if you're panting, at least then we need to walk a little bit faster.
And then the next thing, I heard you talk about the ratio of cardio and strength training. We need strength training from yesterday.
From yesterday.
From yesterday. So we actually start to lose muscle mass from the age of 30. So we can't wait until we get older to start strength training.
About 10 years behind.
Right? I think everybody is. But both cardio and strength training are important. There are actually 11 areas of fitness. So we hear a lot about strength and we hear about cardio, but we don't hear about muscular endurance. So the difference between that and strength is, say, I can pick up this couch once, but that's it. That's strength. I can pick it up.
Right. Right.
If I can pick up this couch 10 times without getting tired, that's muscle endurance. So we want both strength and endurance. We want flexibility. Flexibility, the range that your joint can move in, actually prevents serious injuries when we have falls, or when we trip. If you twist your ankle, if your ankle is not flexible, you'll end up with an ankle fracture. I cannot tell you how many times I've rolled my ankle, but I work on my ankle flexibility a lot. So I got a really bad sprain at the end of my degree, but I didn't break it. I didn't break it, which is great. And that's important because as you get older, not only do we want to prevent falls, but we want to prevent serious injury in falls.
Agreed.
Because in the
Agreed.
elderly, uh, The majority of elderly persons who experience a major fall do not survive past a year after that fall.
You're not telling us to lift the coach 10 times. That's not what you're saying. But how then do we train our muscle? What do you call it? Endurance, and and then the flexibility. Like that's going on a walk, or is that something extra? And can we put that into 10 minutes? Like, how do we work on all of
So,
this?
so it sounds like a lot. It sounds like a lot, but that's why I said you start with 10 minutes. So we don't stay at 10 minutes for the rest of our lives. We start at 10, and then we get comfortable with the 10, we go to 15, and then when we're comfortable with the 15, we go to 20. So we're working our way up. And what we can do is you can either have days where you focus on your cardiovascular health, which is walking, running, biking, dancing, you know,
Okay.
any active movement. People might say, "Well, I got these two bad knees," and I always
Yeah,
tell
yeah, but
people,
you know that's a thing.
you have the Paralympics going on. You have Olympians with no legs. That doesn't
You're
mean
gonna
you
ask
can't
us.
exercise. Yeah, none. So if you
Oh
actually
shoot!
sit down here and do this for 10 minutes, you'll realize that you'll start getting out of breath, and your arms will start to
Right,
get sore, and your heart rate is
right.
going to start to go up because it's movement, it's
It's
active
movement.
movement. So we
Right,
need to find creative ways. There are some people who don't want to go outside, they don't feel safe. I had an old lady that walked around her dining table for half hour. She was like, I had to get my walking around the dining table. Up and down, she said she go around the dining table, down the corridor, up for half an hour inside her house. Up and down the stairs for 10 minutes. You'll realize how fast your heart rate goes. In terms of strength training, you don't need a fancy set of weights or anything. Just at least to start, you can get one of those resistance band sets that are like $20, $15, right?
right.
A 5 gallon bucket, a 1 gallon bottle. You can do your bicep curls. You can lift it up like this. You can lift it up overhead. That's a weight. It doesn't have to be a dumbbell. It can be a bucket. It can be a bottle. For the older people or the people who are not able to go as heavy as early, you can start with 2 tin cans. So 2 cans of baked beans, and those are your weights, you know? So, I mean, with something as little as some bottles, a bucket, and a small resistance band set, you can do so much resistance training. That's muscle training with just those things. Something, even if you don't have equipment, something like slowing down your movements. So something that is very simple to do is to sit down and stand up and try to do it
True.
without using your hands. Now, as you get older, that
Hmm.
actually gets harder to do.
I think so.
Yeah,
Just trying to get up off the couch without using my arm to get up.
people start rocking to get that
Yes.
momentum
Oh
before
yeah.
they get up. So sitting and standing without using your hands, trying to slow it down, see how low you can go to the chair before you drop down, and then try to improve on that. These are simple things that we can do at home to strengthen, especially the everyday movements. So just take note of movements that you do every day, add some weight to it. So sitting down is something we have to do all day. Instead of just sitting, sit stand.
Yes, there are a lot of office jobs, and a lot of jobs, yeah, that require you to be at a desk all the time. So this is actually really helpful. Um, so how exactly do you, because you're an educator, of course, right? And a doctor and a trainer. So how do you approach teaching about the benefits of exercise, especially tailored to older adults or those with chronic illnesses? How do you go about getting the word out there pretty much that yeah, you gotta do the nutrition, you gotta do the exercise, and then the medication then can work its magic, quote unquote. How do you get that word out there?
That's social media. That's my biggest
Social media.
platform, social
Uh-huh.
media. What I do love to do is educate my clients. I mean, At the stage that my clients come, they already know that they need to exercise. So they come to me because they're ready to start exercising. But I love when they bring their children. I love when they bring their parents. And there are actually a few families that I train where I started with one person and they were like, hey, I think my mother should exercise with you. I think my cousin should
Nice.
exercise with you. I think my sister should exercise with you. And all of a sudden I have the family on different days. But definitely word of mouth. So by educating one person in the family, they're able to educate others. I encourage them to bring their children with them because
Right.
when children see exercise as a normal part of life, they grow up doing it as a normal part of life. It doesn't
Right.
feel like something extra to do. We don't get up
I
and
get
say,
you.
mm, I should brush my teeth today and all, but I don't know if mm, I could left that till tomorrow. We don't do that because we grew up seeing our parents brushing their teeth and they're telling us, okay, when you get up on mornings, you have to brush your teeth. Before you go to sleep, you have to brush your teeth. And that is something that was instilled as just a normal part of life. So now you don't even think about it.
Yes,
And
yes, I do.
that's the point. That's the point we have to get to with exercise, where we see it
Right.
as just a normal part of everyday life. Like, yeah, I go in and go to the supermarket and then I go in for this half hour walk here, go home and cook
Right.
something. Like a normal part of life as opposed to
Yes,
something outside of life extra that you
I
have
get
to
you.
do.
No, let me say. But for those who then do not have it ingrained in them, then how do you start making that a habit? We talk about the things that you could do in your house to be physically active, but then how do you really make a concerted effort to embed that, for lack of a better word, into your life, so it becomes like second nature. You know what I mean?
Habit is the word. So at the beginning, just before we started recording, we kind of talked about motivation. I know we're talking about habit.
Yes.
So those two actually go together, and at the same time, they don't. Motivation will get you started, and that's as far as it will get you. The motivation is not going to always be there. There are going to be days, even for me, I like people say when I work out, people see me going slow, and they're like, "Vicky, you alright? Oh, I don't feel like doing this." And they look at me like, "But you in a trainer?
Yeah, yeah. So you're supposed to be on it
I
every
don't
day.
feel like doing this today. I feel like going home and laying on my bed, but I want to do it because it's part of the habit. Now, habit formation is very important, for especially on those days where you don't feel motivated. So the first thing that you have to do is you have to get a cue, something that triggers it. For example, having your clothes in the back of your car when you go to work. So when you come out now, you see your clothes in the back seat, you change and do your exercise. I had an at-home client who, on the days he chose to exercise on in the morning, he would put his sneakers at the side of the bed. So when he swung his feet down one morning, he's half sleepy, foot hit the sneakers, and he's like, "Oh yeah, this one of them mornings, all right."
Yeah, yeah.
And he puts on his shoes and puts on his shirt and goes out and walks and does his exercise. And so there has to be something that triggers you. Okay, this is what I need to do now. Setting an alarm, like a really annoying one, right? Setting an alarm. I need to do this now. You know, things like that. You need to set a cue. This is what we're doing now, and then the next thing is having some type of reward system. The reward system is not food. We are not encouraging that.
I
That
was
is,
listen. You met my heart jump a little bit. I was like, "Woo, reward."
we are not rewarding ourselves with food. That builds an unhealthy relationship with food. All right. So we're not doing that.
Right. So, all right. So, tell me the reward. Tell me.
Well, for some people, it might be, they get to spend an extra 5 minutes at the beach. Or if they go for beach exercise, the reward is going in the water after.
Okay, okay, okay.
So
I
when I
get
finish
you.
this exercise, I'm gonna, watch an episode of my favorite show.
Okay, okay. Well, yes, but not food.
Not food. We're not doing the food thing. And then there is long-term reward. So after 3 months, if I, lose a size, I'm gonna buy myself a new dress.
All right, yeah, yeah. I like
Yeah,
that.
or I'm going to take my friends out to celebrate, or there needs to be something to look forward to.
But you can eat healthy when you go out. Because I don't mean like junk food. I'm thinking like, a nice restaurant, that kind of thing.
We don't want it to be that, okay, I'm going to do an hour exercise so I can go and eat this thing, and then if I don't finish an hour of exercise, I starve myself.
Right.
That's the relationship. It's a slippery slope.
I get you.
It's a slippery slope where you can go down to it being like a bargaining and exchange, and you don't want it
Right,
to be that.
right. Because there is talk about like, having cheat meals and that kind of thing. And cheat meals are a cheat meal. It has that kind of reward type of thing to it. So you go through the week and I finish and I exercise every day and everything. So I deserve this and I want sorry. So you're saying that this is unhealthy? Like that would be an unhealthy practice to have?
It depends on the type of person you are and what your motivations are, where your motivations lie. If you're a person that's self motivated, it may not affect you in that way. But if you're someone that needs external motivators, it might create an unhealthy attachment to food. So there's nothing inherently right or wrong when it comes to
About it?
fitness.
Okay.
But it is definitely finding what works for you.
Right.
And what works for me is having what I like, but in moderate amounts. So instead of
Right.
eating 2 scoops of ice cream, I might have one.
Right.
Instead of eating, whole Kit Kat bar, I might eat half tonight and then half tomorrow night. You know,
That takes
uh,
some real dedication there, boy. I can't do that with a
yeah.
Snickers. Snickers is my thing. I have what it did though is that they have like the big one that kind of is two in one. So you can
Yes.
use that if you like Snickers. You can use that. We're
Or
not
the
eating
little
Snickers.
tiny ones. You buy the bag, the little
Oh my
tiny ones, and you
gosh,
have
that's
one.
a slippery slope in itself. Them so much, and then you can tell yourself that this is small that I could have about five more and it wouldn't do
Uh,
nothing.
and see, but it is then there comes in the discipline. So with
Right,
habit now, then comes discipline. And I will say it is difficult at first. I would encourage people not to try to make a whole bunch of changes at once. Definitely take your time. If you're
right.
doing the exercise thing, start with the exercise, leave the diet as it is. Start with the exercise, and once you get going with the exercise, then start making small changes with the food or other way around. Definitely don't try to just overhaul your life.
Yeah, that don't work. When you go through all these big changes all together, and then I think then there's the guilt or yeah, like you might start to feel bad because you haven't, you went through all this effort in the beginning, and then you start to teeter off at the end, and there might be like this kind of guilt because one, you didn't stick to your new routine, and then somebody can ask you, so how it going, and you, yeah, all right, but you haven't been or you haven't done anything. And I do find that is harder to maintain. I think that's probably the best word. When you go all in, you know, and you're like, yeah, I can be an hour and a half at the gym, and the gym don't see you for the next 2 3 weeks, right? Because you went all hard, and then the next day you sore, And you're like, all right, I ain't go back today, I can go tomorrow. And then, so I do agree. It is quite a slippery slope when you go all in and do too much in the beginning. Um, but then on the flip side, when you say about 10 minutes, you mean I don't really do nothing. Not 10 minutes and do nothing. So maybe that's motivation for you to go longer. But then we also don't want the flip side where it's like, well, oh, really that 10 minutes don't do nothing for me, and then you stop that too.
Right. So that's where the habit and dedication, discipline comes in. Because I just came off of vacation and I had clients messaging me like, why I missed the gym? I said, I don't know. Why do you miss the gym?
What do you, Mr. Jim? Pray
I thought you
tell.
hated me. But listen, it feels so strange not going. It's like I don't know what to do with my Tuesdays now. I accustomed being at the gym at this time, and I'm just like, I don't know. Why did you leave me? I had a couple people
Yes.
ask now, why did you leave me? I had to go on vacation. What do you mean? But
uh,
it's good to hear that they're actually in that mode where they feel like, okay, I need to be at the gym because that means
yes,
the
yes,
habit has set in, the dedication
yes.
has set in,
We know that
and
that
they're
happens.
missing that habit. It
Yes,
happens eventually,
yes, yes. It does. It does. For me, I remember one time I was going with a friend of mine, and then she stopped going, and that offset the whole. It was that was done. I went a couple of times afterwards by myself, but then I was like, Andy, Sam.
and that's where I talked about being self motivated versus needing external motivation. Some of us need to exercise with people
Right, right. And then you bouncing off each other and that kind of thing. So it's good that you're going with your friend, but like the day that she say I'm bolted today, and you can't convince her, or maybe something happened and she can't make it, and then your motivation goes down. So yeah, self motivation is a big. You have to do it for you
for sure,
first, and then if they can come, then you could do that. But yeah, not the self reliance on somebody else, because that is a recipe for failure as well. Now, so you have your own. I won't say practice, but you have your own. So it's a consultation, it's a practice, it's a business. What do you have?
all of the above.
All of the above. I like it.
Yes. So I still practice medicine. I still practice medicine. So the first service that I do offer is personal training. I do one-on-one or tandem, which is two people training, where I design a plan for the person and we spend an hour together and we do exercises together specific for them. The next thing that I offer is my Valier movement class. And that class is an indoor outdoor class. It is 3 days a week. I do not call it a boot camp because this is not a boot camp. It's not you have to get this done. There is a workout for everybody, but because it's a small group, I tailor it to the people that are there. So if there's someone there who say has a shoulder injury, so they might not be able to do a shoulder press, I give them a different exercise to do in place of it.
Okay, so you tailor the exercises, yeah,
I tailor the
depending on.
exercises. It's still pretty individualized, even though it's a group setting. They're all very welcoming. They're all very, encouraging. We're not a group that laughs at what anybody's wearing. We don't care if you lift 5 pounds. Once that 5 pounds is your best, then people be like, "Yeah, boy, lift the weights, man." You will get that encouragement regardless.
That's cool, like a community of some sort, supporting each other.
I also have a seated exercise class. That's for the 65 plus. Yeah, seated exercise. So a lot of people think that you can't sit and exercise. Of course, if you can stand, please stand.
I was saying that's on the list on my alley. So sit down exercise. Yeah, I could do that.
No, no, no. It is for no. And I get that a lot. I say, oh, for me, no, you are not over 65. And you're fine. You need to stand up. But yeah, my older people, they love that class. And it it had started from me volunteering with Age UK in London. And
Okay.
as part of my degree, I actually had to go into classes. I actually had clients during my degree, so it was very hands-on.
Oh,
And
nice.
I participated in this first CP class, and my legs were burning at the end. Now, let me tell you, I had to walk to catch the bus, and it was a very long walk. And
Oh.
these older people were all like, "All right, so we just see you next week," and I'm just like, "Okay, all right, my legs hurt." But that just goes to show you that it can be very challenging. So I love working with my seniors. They lift up all the weights. They tell me stop bringing the green bands because that's the very light band. They said, Vicky, don't bring back these bands. These bands ain't doing nothing for nobody.
Oh, that testing them.
And I was like, oh, sorry, too easy. So I had to go and bring my cloth bands and the stretching goes out too. So I don't even know what to do next. But I love the group. They're fantastic. And then I also have virtual training. So I do have a couple clients overseas. So for anybody who's watching this overseas, I have one in Wales, I have one in New York, I have one in Grenada. They're all over the place.
In what age range are the virtual?
It's for anyone, but a couple people are, yeah, I train any age. I train any age. Let me get that clear. I don't only train seniors. Uh, but I do train you with the intent of healthy aging because healthy aging starts from birth. Everything you do in your childhood, teenage years, early 20s affects how you live when you get older. But mine are between their 40s to 60s. Those are my
40 to
online
60.
clients.
And mainly women, mainly men.
Mainly women, but I do have some men that I train as well. It's a little more difficult to get the men in because they're like, man, I work hard already, and
It's true. It's true.
come, let me show you. Let me show you that you need to work a little harder sometimes. So it's a little harder to bring them in sometimes, but they do come. And then for those who may be experienced in exercise already or who can't quite get out of the house, I both do house visits and I do at-home written plans.
You be
So they're
busy.
people. Yeah, yeah, I write
Wow.
plans.
You
So I give them a monthly plan. They go to the gym on their own or they work out with what they have at home and they get that, they do that plan. Um, yeah, and then finally, I do exercise prescription consultations. So that's where a client may have their own trainer, but there's someone who has multiple chronic diseases and they see me. I
right.
assess their chronic diseases, what medications they're on, etc. And I make recommendations based on that. No, I don't write the plan for the trainer because that's not my job. You already have a trainer to write that plan. But I might say, well, this person is on beta blockers, which is a type of medication for the heart. This person is on beta blockers. Please be aware of cardio, that their heart rate is not going to go up like it should. Please don't put this person to go above 90 beats per minute heart rate. I give them guidelines. This person has obesity, so they should not do any exercises that lay flat on their back so that the trainer can then make their plan around what they should focus on and what they should avoid.
All right. Well, that's a lot. And you forgot one thing. Now I'm gonna bring it right now. Do you have an apparel line?
Yes.
So on top of all of that, you got the apparel line, and get this, guys. It is called My Trainer Sucks. So can you? I can see that user drill studs. Can you tell me the inspiration behind My Trainer Sucks apparel? So I assume this is fitness apparel.
Yes. Well, at the moment, yes, is tank tops, t-shirts, and it is due to my clients.
They tell you that you suck. What are you doing?
They tell me worse things. That's okay. I know they still love me. They're gonna tell me that they don't like me, that they hate me. I've been called a devil spawn before. Um,
Not
things
devil
that I probably
spawn.
can't say here. Yeah, yeah. And I just go, all right, great. I'm glad you think that of me. Anyways, so you still have 10 more reps.
Right, right. Okay.
But what I put on these shirts is literally things that they have said to me. So, for example, I have a shirt that says, "Was this here no?" That's something that my sister says every time I'm training her. Almost every exercise I give her, "Was this here no? Was this here no?" So I put it on a shirt. I have another client that when he gets fed up with me, he's like, "Don't talk to me."
I love that. Don't talk to me.
I put shoots on the shirt because everybody always shootsing at me. Yeah, whatever comes out of their mouth that sounds funny.
I like it. I like it, and then they gotta buy it because they said it.
Yeah, they do buy it and they wear it, and then they come to training and they're like,
Don't talk to me.
and I'm like, right, except you pay me to talk to you, so that's not gonna work.
Yeah, yeah, yeah. Unless you know sign language.
I know sign language.
Oh,
I know sign language.
and they would have to as well, right? They would have
Right.
to as
Well,
well.
yeah, yeah. They were like, seriously. So when I start, it's like I learned sign language for this.
Oh my God, you can't get away with you. Um, okay, so who then is your primary audience, and wait, how do you reach them? Because if yes, you specialize in the age and chronic illnesses, so I know that there's not a specific like age range, but then for the more senior clients, how do you? They're not on Instagram because you said social media. They're not
They
on
aren't.
Instagram. They
They
are.
aren't.
They are.
You will find that there are a lot of them on Instagram actually.
Really? Well, my mom, for instance, not Instagram. She's on Facebook,
Yeah.
but
So
she
I have them connected. So I reach
right.
them on Facebook,
Okay,
Instagram,
okay. And mom, I'm
forums
not
like
saying you're
this.
elderly. Let me just clear the air. Just I was just using you as an example. Okay, love you. Okay, so yeah. So how do you reach them? So they reach out to you on Instagram or Facebook,
Hmm.
or is there a particular
Our Facebook.
platform that they reach out to you most on?
Mostly calls actually.
Mostly calls.
Somebody tell them about me and gave them my number and they call me.
So
Like, okay, this sounds
referrals.
good. Referrals, Instagram, Facebook. A lot of them it's their child or grandchild or niece, nephew. See it on social media and then tell
Right.
them about it.
Right.
So
Okay.
it's still social media in a way.
Right.
Uh,
Right.
and then when I give talks, so things like this,
Right.
sometimes I give community lectures, health
Nice.
fairs. People hear about me that way and they reach out to me that way as well.
Okay. Okay. Great. So no marketing, um, at all. I mean, in terms of like, I guess like paid advertisements, or is it
I do
mainly
the
like a
Instagram ads sometimes.
okay, but you don't really find much
I don't do
success
like
for that.
radio, TV, that kind of stuff. Not really.
But you would do like these sponsored posts and that kind of thing to help get the word out there. Okay, okay, that is good to know. And you get the responses that you get, or do you get like good responses from the Instagram ads and stuff? And those people are in your well house. Those people are the ones with the chronic illnesses and seniors. Oh, that's great. That's great to know that's working for you. Um, so, then I guess what is the main challenges then that you encounter when training, um, I guess older women, and then how do you address that in your sessions? What's the main challenge?
how do I say this without offending my target audience? uh, Baby boomers are the most stubborn people I've ever met in my life. That generation is all the way stubborn. And I tell them that to their face so they can't get offended now. I'm just like, you're stubborn. And some of them laugh and say, well, yeah. So sometimes trying to get them to trust me and do the exercises that I tell them to do, they'll be like, so why you gotta do this? Because it does XYZ.
It's gay bear trouble for you. You're right.
It's like, you know that you brought me here to tell you what to do, right? I get very sassy with them, and they're like, you're rude, you two. Let's go. But we end up having a good relationship, you know. But that definitely they can get very stubborn when they're ready. But we still end up achieving what we have to achieve. So it all works out.
So what is your most I guess popular service like that everybody loves that you gotta be like I can't attend no more right now, maybe next week.
I would have to say between my Valera class and personal training, especially the at home training. A lot of the older people who can't get out, they like that I can come to them. And I come to them with my car full of equipment. I actually have to change vehicles now because the little car is not working with the big equipment.
You got one of open bed trucks or one of them look a little Suzuki van or something where you really back just got all the equipment in the back. Well,
Yeah,
that's
but I come with everything. I come with everything, and they like that I'm able to come to them and give them a good workout where they are, as opposed to them trying to get somewhere.
yeah, at home kind of service. Oh, that's good. Well, I'm happy to hear that. So okay, so we're gonna wrap up soon. Like, but what do you see, or where do you see the field of exercise medicine heading in the next decade, especially regarding chronic illnesses and aging populations? Are there any new things? I don't know, technology or programs or anything new surrounding that that you could see happening in the next decade or so?
Well, first of all, I would love for more doctors that do exercise. Please, please. I'm not like people who want the whole field to myself. I can't train everybody in Barbados. I can't prescribe exercise for everybody in Barbados. Please, 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 more doctors go and do this
Okay,
because
okay.
it's important. It's an important part of our healthcare that we really do not pay enough attention to. We have the nutritionists, dietitians in the polyclinic. We have the GPs, the pharmacy, podiatrists, dentists. But we don't have anybody talking about exercise. And exercise is such a big part of our health and management of our health and just everyday living that yeah, I want to see more doctors learning about exercise prescription and being open to learn about
Right,
exercise prescription. Even
right.
for the GPs, a GP can give a basic meal plan, but then they're going to refer you to the nutritionist, but they can tell you, well, if you have hypertension, you should, try not to use the all-purpose seasonings and use fresh herbs and spices. And, they can tell you what little changes to make before they send you to the professional.
But not the all-purpose seasoning. But yes, sorry, yes, not the all-purpose seasoning.
All-purpose seasonings, Maggie cube, Oxo cube, please don't sue me. All those things contain quite a bit of salt, but
What you want, break my heart? But you don't use the salt with them. You know, but you just use it by itself. Still no. This is still a no.
you ever taste a Maggie cube?
No, because I feel like that would be gross. Um, but like once you use it, you don't got putting the salt in because it's already like it's the seasoned pocket cube. Okay, so more doctors in exercise.
So yes, that's what you're saying. So the same way we would want more GPs to be able to say, well, you have hypertension, so don't do any, 1 rep maxes. Don't try to bear down and hold your breath to lift anything. or you have diabetes, so be careful with stuff with your feet. Don't just go in the gym with new shoes. You are breaking your shoes first. Stuff like that.
Right, right. I did not know that was a thing. Yeah, Dr. Victor dropping all the gems. I just figured you buy a pair of shoes and the only time you're wearing them is when you get in the gym. I didn't know you had to bread them in first. This is a
You need to break in shoes.
You got breaking the shoes. No Maggie cubes. Start with 10 minutes a day. Let me see. Well, say missing. Do not reward yourself with food after you complete your workout because that could form unhealthy habits. It's okay to cuss your trainer. Wants to buy the shirt.
Well, there are two things. There are two things that I always end with that I want people to remember. And one one thing is start where you are and do what you can. Do not try to be like the influencers because the influencers are not even like the influencers. They go
You
and pour
done
some
know.
water on themselves and lift
You
up
done
heavy
know.
weights twice for the camera and go home.
That's
Just
it. That's it.
right, start where you are. If you could only lift up two tin cans of corned beef, then lift those up until you could lift up the two-liter bottles, right? So
Agreed.
start
Mm-hmm.
where you are and with what you can. And the second
Yes.
thing is never too late to start. I do not care if you're 80 years old watching this with your granddaughter, you
Mm-hmm.
can start exercise today. I
Yeah.
don't care if you ever did sports at school, you can start exercise. You can start by dancing. You can start by, I see the people doing the roller skating. You can go swimming. There's a free elderly learn to swim class that the government is putting on. Go and join that. It's
Nice.
free. Like
Nice.
anything that you can do to get active and get moving at any age is beneficial. So two things, start where you are, and it's never too late to start.
Oh, that is a awesome, I guess, last words for this session, this podcast. And thank you so much, Dr. Vixter. That's going to be in my head now, not Dr. Vixter. You,
That's good.
this was such a good session. I found out a lot of things I did not know about, and I'm sure that our listeners will have the same thoughts as well. So thank you, thank you, thank you. And you have an awesome day wherever you are, listeners, and you, Dr. Vixter.
Thank you very much. Same to you, and thanks for having me.
Thank you for joining us on another Wellness and Growth Journeys podcast. Now, if you're inspired to elevate your health and wellness business, the Wellness Growth Agency is here to guide you. We specialize in tailored digital marketing strategies to enhance your client engagement, grow your practice, and improve overall satisfaction. Let's unlock the potential of your business together. Visit us at wellnessgrowthagency.com to learn more, and don't forget to subscribe to our podcast for more insightful episodes. Until next time, keep thriving and remember, wellness is a journey. Growth is the destination.